special report number 19 together with her team. And we would like to see your presentation now.
Thank you very much, Mrs. Hohlmeier, Chair of the Cont Committee, and Mrs. van Bremt, Chair of the COVID Committee, honourable committee members, ladies and gentlemen. Thank you very much for being interested in our report, and thanks for the invitation to your joint committee today. I will present you our audit on the EU's COVID-19 vaccine procurement today. We all remember the dark days back in spring 2020 when the COVID-19 pandemic broke out. Luckily, the situation now is not as severe as it was in 2020. The EU identified vaccines as a priority in the response to COVID-19 early in the pandemic. It then started focusing on the development of a safe and efficient vaccine as a solution to ending the health crisis. According to a study published in June 2022, vaccinations may have prevented almost 20 million COVID-19 deaths worldwide. We chose this topic because of the central role that vaccines played in the response to COVID-19 pandemic, the unprecedented nature of the EU's involvement in vaccine procurement and the expenditure involved. This report examines whether the Commission and the Member States procured COVID-19 vaccines up to the end of 2021 effectively. So how did we check if this was the case? Firstly, we looked at whether the EU's preparations for the procurement of COVID-19 vaccines had been effective. Then we assessed whether the EU's negotiators had been able to secure timely access to vaccines for the EU in the contracts it signed with its vaccine manufacturers. And finally, we reviewed whether the Commission had addressed any issues impacting the supply of vaccines. We also benchmarked the EU's performance with that of the UK and the US to understand what lessons could be learned from a comparison with other procurement systems. And we chose these countries as both have domestic pharmaceutical research and production capacity and procured vaccines from some of the same companies as the EU did. So what did we find in our audit? If I can boil it down to one key message, it's this. After initial challenges, the EU secured sufficient doses of COVID-19 vaccines. However, there are still lessons to be learned. What do I mean by that? As regards the EU's preparations for the procurement of COVID-19 vaccines, it identified vaccines as a priority in the response to COVID-19 early on, created a tailor-made procurement system, but started procurement later than the UK and the US. In addition, the Commission has not yet scrutinised or benchmarked its procurement process to learn lessons for future improvements, nor does it currently plan to test its pandemic procurement system through stress tests or simulations. Secondly, on the contracts the EU signed with vaccine manufacturers, we analysed the contracts and found that the terms of these contracts evolved over time, and those signed in 2021 have stronger provisions on key issues such as delivery schedules and production locations than those signed in 2020. The EU negotiations secured a diversified vaccine portfolio for member states. Such negotiations followed a procurement process laid down in the EU's financial regulations, but at the heart of the process were the preliminary negotiations that took place before the tender invitations were sent out. The financial regulation does allow for the contracting authority, in this case the Commission, to negotiate in certain cases with tenders ahead of their offer submission in order to improve their offer. In that sense, the preliminary negotiations were not irregular. The extent of the agreements reached in these preliminary negotiations, for example, price, volume, liability, even if they did not lead to any formal or signed document, did stretch the provisions of the financial regulation, since the launch of the tender process was conditional on an agreement being reached at this stage. The Commission was open about this process with us and shared in all but one case, many documents and emails from this stage of negotiations. Regrettably, we didn't receive any information on the preliminary negotiations for the EU's biggest contract, which were conducted directly by the President of the European Commission. The Commission, on behalf of the Member States, signed contracts worth up to €71 billion for deliveries of up to 4.6 billion COVID-19 vaccine doses. The weighted average cost per dose was approximately €15. Whether the Commission paid the right price for the vaccines was out of our audit scope. However, the publicly available information on average cost per dose paid by the UK, which was published by the UK National Audit Office, shows that the EU paid a similar price to the UK. Finally, as regards the Commission addressing issues impacting the supply of vaccines, we conclude here that the Commission had limited leverage to overcome supply challenges. The Commission acted as a bridge between companies and Member States for contract implementation, but when the EU was confronted with the severe supply shortfalls in the first half of 2021, it became clear that most contracts did not include specific provisions to address supply disruptions. The Commission only set up a task force to support vaccines manufacturing and supply chains in February 2021, and while it did help to resolve bottlenecks, it's still unclear how much impact it really had on ramping up vaccine production. Nevertheless, by the end of 2021, nearly 952 million vaccine doses had been delivered to the EU member states, and 80% of the EU's adult population had been fully vaccinated. As the EU's external auditors, we aim to identify blind spots and suggest improvements in the areas we audit. In order to improve the EU's preparations for and response to future health crises, we make two key recommendations to the Commission. Firstly, in May 2022, the Commission put forward a proposal for crisis management in the financial regulation and a proposal for Council regulation on a framework for medical countermeasures at EU level in the event of a public health emergency. We recommend that the Commission support the implementation of these measures by creating public procurement guidelines based on lessons learned. And secondly, we recommend that the Commission stress test the EU's medical countermeasures procurement approach. In particular, it should carry out a risk assessment of the EU's procurement approach and test all parts of its updated pandemic procurement strategy to identify any weaknesses and areas for improvement. So that's a very brief introduction to our audit. I would like to thank you once again for the invitation to this joint committee meeting, and I will be very happy to answer to your questions I'm sure you will have. Thank you very much.
Thank you very much, dear Ms. Elvinger. I'm speaking now afterwards on behalf of the colleague Savama, who cannot be here, but first we would like to listen to the Commission, and I would like to give the floor to Mr. Philip.
Thank you very much for the invitation. The Commission welcomes, obviously, the special report by the European Court of Auditors on the EU COVID vaccine procurement, and we would like to thank also the Court for the thorough work done and invested into this very complex matter. The vaccine strategy, as we all know, to fight COVID pandemic is an unprecedented and resounding success, ensuring access to COVID vaccines produced centrally at EU level for the first time and setting a precedent for EU cooperation in health. As it was stressed by the Court, the EU's tailor-made centralised system for vaccine procurement succeeded in creating a broad and very diverse portfolio of vaccine candidates at a time when no vaccine was yet on the market, and in procuring sufficient doses of COVID-19 vaccines made available to all Member States at the same time and under the same conditions. The Commission is now drawing on this experience and the lessons learned during the COVID-19 pandemic in its work to set up a strong European health union and improve the joint EU crisis preparedness and management. The recommendations by the Court will provide very useful input for that particular process. The EU started the procurement process only 2 months after WHO declared a public health emergency of international concern, and we would say that it was an extraordinary achievement given that it required the agreement and the solidarity of all 27 member states. Through that EU vaccine strategy, the Commission and the member states were able to secure the broadest portfolio of vaccines in the world at a moment in time where there was no certainty whatsoever that any of the vaccines under development, and there were hundreds, would be successful. So this point bears some stressing. It is very unlikely that many member states would, on their own, have had some similar access to such a portfolio. This would have been a major differences in access to vaccines in the EU, and therefore the EU approach ensured equitable access for all member states at scale needed and at the earliest possible opportunity. In less than 1 year after the start of our vaccine strategy, between December 2020 and March 21, already 4 COVID-19 vaccines received conditional marketing authorization for use in the EU, and doses were delivered to all member states, as I said, at the same time, following a fair and equitable distribution. By this, and by end of August 2021, the Commission had already met its target of having 70% of the EU adult population fully vaccinated. By now, we have reached roughly 84% of the EU adult population fully vaccinated, and about 70% have already received a booster dose. On the manufacturing and the production side, in a year, about 3 billion doses of vaccines were produced in the EU. In addition, the EU became the region in the world that had exported vaccines on the largest scale. It's about 2/3 of the vaccines produced in Europe that were exported to 167 countries. And by now, Team Europe has shared more than 500 million doses to third countries, thus making sure that the world might exit one day of this massive pandemic. Thank you very much.
So thank you very much. I first read out the comments of the rapporteur on behalf of Mr. Sarvamaa. And dear colleagues, thank you, Ms. Elvinger, for the presentation and for this important report. It is clear how the pandemic forced us to act quickly and decisively with regards to the procurement of vaccines. The situation was new and decisions oft had to be made on the basis of incomplete information. It is therefore important that the procurement process of vaccines and the Commission's practices are carefully evaluated afterwards. This will allow us to learn and prepare for future similar situations, taking into account, for example, the fact that the EU started purchases of vaccines later than the United Kingdom and the United States. As rapporteur for the working document, I can fully agree with the ECHA recommendations. However, I would still underline that it is important that the Commission continues its work to make sure that it has the effective tools to respond to future crises and in order to act in the common interest of the Member States. Attention must also be paid to how much money has been spent on the joint procurement of vaccines. In the future, special attention should be paid to the cost issue, and it should be ensured that EU funds are used efficiently and appropriately. Additionally, I would like to remind you that promoting and ensuring transparency also promotes the efficient use of taxpayers' funds, but above all, trust of citizens in the EU institutions. Lastly, in the future, the Commission and other authorities also should pay maximum attention to ensure that EU regulations for deliveries are not delayed because of other contracts. Keeping in mind the main objective of the Commission's vaccine strategy published in June 2020, which was to ensure the rapid availability of vaccines to the Member States and their citizens. Further questions to Commission and perhaps even to Ms. Elvinger. I change to the German language.
Which measures must be taken to ensure that in future we can take action swiftly rather than having 27 different processes and a lack of coordination? Second question, what steps need to be taken to ensure that in key areas of science and research we are in a position to react to known challenges such as the SARS virus? We'd already been talking about this. We could have foreseen that it would potentially affect us at some point, but member states weren't necessarily in an optimal position to respond. Third point, there was an issue with availability of drugs because they were not being produced in Europe. Is the Commission considering how they might preempt and avoid these problems in future to ensure greater safety and security for citizens? And a fourth question, what steps will the Commission take to ensure that financial provisions are made to avoid panicked reaction to pandemics and signing of contracts? How can we ensure we're better prepared to signing contracts? How can we ensure greater transparency? And indeed ensure that the European Parliament is given full right of scrutiny of these documents to understand how the contracts were signed and check whether the prices paid are fair. In the recent past, it was difficult to do this. I'm not blaming anyone. We were completely unprepared. Member states had refused to take preparatory steps years before the pandemic emerged. The European Parliament had been calling for this since 2011. We need to look at cooperation between labs on key drugs and dealing with different groups of pandemics. We need to ensure better cooperation within Europe, identify companies that might be in a position to ramp up production, help with swift deliveries so that we're not responding chaotically. The Commission did the best it could at the time, but it was by no means ideal. I think we could have been better prepared. The member states could have shown greater will to be better prepared. Now, I'd like to give the floor to Tomislav Sokol on behalf of the COVI and the EPP group.
Chair, thank you, Ms. Elvinger, for your presentation. So I would just like to mention in the beginning that it's not true that the Commission didn't have power to act in the beginning. So according to Article 168.5 of the treaty, the European Union can act and introduce measures to combat cross-border health threats. So this is in the treaty. So it's not true that the Commission didn't have the competence or power to act in the beginning. There are other reasons why it took some time, but it's not the lack of competence. So this is one specific area of healthcare where EU has more power to act than in other areas of health. But that aside, in general, I think public procurement of vaccines was an overall success, especially for smaller member states where there are no production or there are no sufficient production capacities, because this common joint system made it possible for these states to get the vaccines more or less at the same time as those bigger, more developed member states with strong industry, especially strong pharmaceutical industry. I think that is the main benefit of this whole system. However, it is true that some things could have been done better. And I'm especially interested in why do you think that US and the UK were able to start the procurement sooner, especially since they were able to start the procurement sooner of vaccines which are produced in Europe. So what can we do to prevent such a thing from happening in the future? Do you think an export restriction could have done the trick, or do you think that the notification mechanism that was introduced was enough that the Commission do? So what could have been done better and what could be done better so to prevent this from happening in the future? And also, what is your role, what do you think, what should be the role of the European Parliament in all of this, especially during the negotiation stage? Do you think that European Parliament's role should be strengthened such early on. So already in the negotiation phase when such contracts are being negotiated. Thanks.
Thank you very much. Now I would like to give the floor to Sarah Cerdas from SND Kovi.
Yes. Thank you very much.
I didn't know if I spelled your name. Cerdas or?
Cerdas is fine.
Cerdas is fine, okay.
Thank you very much.
Sorry.
It's all right. Thank you, Madam Elvinger, for being here and presenting your report. Indeed, it's a report that we have been very eager to receive and read when it came out, especially on the COVID committee. You state in your report and also in your presentation here about how the different procurement processes and negotiations were done. However, you also mentioned that in the report, some normal documents associated with the preliminary negotiating procedure are missing from a Commission's biggest contract, meaning the third Pfizer contract. I would like a bit of clarification. Which documents are these that are missing and why are they so important? We also heard on Monday in a very lively debate with Pfizer, a hearing we had with Pfizer, the company's director presented. She stated that the SMS exchange between Ursula von der Leyen and Mr. Burla should be seen as a normal feature of teleworking. Would you consider the lack of transparency on these preliminary negotiations a case of maladministration, like the Ombudsman concluded in regards to the text messages? And also one last question is that the report also states that a planned meeting on the scientific advisors for the vaccine strategy did not take place in 2022, and if in your opinion the purchasing strategy for more vaccines for 2022 and 2023 should be more thoroughly discussed. Thank you.
Thank you very much, Sarah. I would like to give the floor first to Ms. Elvinger and then to Mr. Philip, both together 6 minutes, so 3 for one, 3 for the other.
Thank you very much. So as regards the first questions or comments, I think that as regards the measures to be taken in order to have a better process, I think the treaty here gives clearly the competence to the member states as regards health issues, and I think this was the first good experience. It was an unprecedented pandemic, and I think the EU here didn't manage too badly. As regards the second question, which concerned the Court of Auditors regarding the question whether UK and US, what they did in order to, whether they negotiated maybe better contracts or why their procurement was quicker. We can say that the UK and US have not published their procurement contracts, and our aim was not to do like for like comparison of contracts, but to point out actually some interesting or notable features of the UK and the US contracts and their procurement systems more generally based on publicly available information. It is very interesting as well to see that the UK and the US use different means at their disposal to try and get leverage in their relationships with vaccine manufacturers. And the US government can use actually the Defence Production Act, which gives it a big advantage. But even the UK took some steps, such as reserving fill and finish capacity it could offer to vaccine manufacturers. When there is global competition for scarce resource, it is interesting to look also beyond the contracts to see to ensure supply for citizens. So. And then there was the questions about missing documents. Actually, we received no documents on the preliminary negotiations of that biggest contract. That's true. This is really regrettable for us. We actually, according to the treaty, we must receive all documents. We didn't receive them, and therefore we had to limit also the scope of our audit, which we state in our report in paragraphs 47 and 48. So unfortunately, that was the case.
Herr Philipp.
Many thanks. On the first set of questions around measures that could have been in place or should have been in place for procurement, we should not forget about the existence of the joint procurement agreement. That's an agreement between Commission and Member States to organize joint procurements. But experience has shown that the agreement as such is difficult to implement in crisis times because it requires at the end of the day exclusivity. It requires at the end of the day also a good level of solidarity, and it requires also to react quickly. So that was not the right instrument for that situation when there was a global run on potentially limited production capacities. That was the limiting factor here. Now, since we have, so there was a lack of institutional competence and also institutional capacities in that area. But we should not forget now, in the meantime, through the development of the European Health Union, one very tangible achievement is the creation of the Health Emergency Preparedness and Response Authority, where I have the pleasure to work with several colleagues here, and we are doing exactly what you mentioned in your remarks. We provide an end-to-end solution here, or we develop an end-to-end solution basically from the detection of threats, making sure that they're properly assessed, making sure that work goes into the assessment if medical countermeasures, drugs, vaccines, whatever you would need, are available at scale to react. If not, then there is possibilities to trigger also the research and development of such medical countermeasures, and goes down to the deployment of such medical countermeasures. When we look now in times of crisis, if that would hit, there is a council regulation currently that is going to be adopted pretty soon, and here we will have different mechanisms. So we will have a health crisis board, which is led by Commission President and executive high-level politicians from all member states to take decisions swiftly and properly, obviously based on what has been developed and done during preparedness times by HERA. Funding will be available and can be triggered quickly in case of a public health emergency through the emergency support instrument. And there's also some other triggers to launch research, to launch production, to have access to information on supply chains swiftly in times of crisis. So that is a good part of lessons learned, translated into reality. Coming to the point on the Commission had power, the Commission had a certain power to coordinate with Member States' response under the existing cross-border health threat decision that was in place at the time. But coordination requires here as well a good level of openness and sharing of data, sharing of resources, and sharing of making decision in a bigger context by all member states. We must say, and was mentioned, that obviously the approach to the implementation of the vaccine strategy was a success. All member states had equal access at a pro rata ratio to available vaccines. All got them at the same time, and there was also a good level of solidarity by shifting doses from one country to the other when it was needed. On the point on US, UK, obviously, as was mentioned, we had to develop the whole process from scratch, but I think it's important to look at the outcome. And the outcome means availability of vaccines at a certain time point, and also uptake of vaccination by the population, and that can be easily looked up. That went relatively quickly once the vaccines were available, beginning 2021. And that's what I wanted to say here.
I think the question about the documents will be repeated. Then I'm absolutely sure, because the next speakers, I'm sure that this will be the case. So now I would like to give the floor to Véronique Trier-Lenoir from Renew Europe.
Merci, Madame.
Thank you, Madam Chair. Your prediction is spot on. Thank you, Ms. Elvinger, for your excellent report. Thank you, Mr. Philippe, for the information provided. I am rapporteur on the regulation dealing with serious cross-border health threats, and as such, I regret the fact that your analysis of the recommendations was not made available to us sooner. We would have liked to take this on board in our legislative work. My questions now. Firstly, you underline that European experts in the steering committee dealing with negotiations and validating contracts did not have any scientific experience. That was not the case for US and British negotiators. Do you think that this had an impact on the contracts signed, in particular with AstraZeneca? There were many shortcomings linked to that contract. Another question. The first round of contracts did not have any clauses dealing with priority access, and that again was different to the British and US contracts. That placed us in a very difficult position in our dealings with AstraZeneca. Do you believe that in future the European Union should systematically introduce a clause stipulating priority access? Third question. In the first generation of contracts, liability for any side effects was shared between member states and the companies in question. That might be feasible in times of crisis, but only in times of crisis. Has the Commission stated its wish to move towards a more traditional form of liability in future, beyond the current crisis? And one final question, no dodging this. The Commission did not reply to your request for access to text messages shared between the President and the CEO of Pfizer. I've called for more transparency and independence. Let's be constructive, however. Is it not now high time that we overhaul the regulation on access to documents so that we can bring it up to date and reflect new technologies such as text messages, look at requirements on storing such digital messages? Thank you.
Je vous remercie, Véronique.
Thank you, Véronique. Michel, over to you now.
Merci, Madame.
Thank you, Madam Chair. My thanks to the Court of Auditors first and foremost. You have done sterling work here. You have provided us with information that we wanted in the European Parliament. I'm a member of the Budgetary Control Committee, and we'd been looking for this information and didn't have it. Let me reply to the Commission on transparency. We as MEPs feel very frustrated about the way things went down during the pandemic. We had access to no information about pricing, about the European budget and the financing made available to different companies. Ms. Galina came along to the Budgetary Control Committee on a number of occasions, said we'll wait to the end of negotiations and then we'll give you insight into the contracts. I can understand that you can't make everything public while negotiations are underway. Now the negotiations have been finalised and we were not given access to anything useful. All the documents have been heavily censored. We don't have information on pricing, on the amount of money made available to manufacturers. The only source of information was CureVac, Pfizer, AstraZeneca. They didn't give us anything. All we're relying on is leaks from journalists. So the real breakdown there. I welcome what you said on the third contract between the President of the European Commission and Pfizer. I've nothing against Ursula von der Leyen, but there's been a problem here with the way the institutions work. As you underscored, and as the European Ombudsman has underscored, this is negotiating by text message. The lion's share of negotiations took place by text message. And what about the preliminary negotiations and access to those documents? And there's a real issue with compliance with European legislation here. You're very interested in supply of vaccines, delivery of vaccines, but what about the prices? While these special negotiations were ongoing, member states were being kept briefed. So how can you justify the increase in vaccine prices? The Bulgarian Prime Minister said during the last round of negotiations that we saw prices rise from 1550 to 1950 for 1.8 billion doses. So what is the justification for this price rise? Do you have any information on that price rise? It has a bearing on member state budgets at the end of the day. And one final question that's of direct interest to the Budgetary Control Committee. What about the advances made available, 2.5 billion released for manufacturers? We'd like traceability for such financing. What did these manufacturers do with this money? Some like Sanofi, CureVac did not produce vaccines at the end of the day. What did they do with this money? Did they reimburse the Commission? Commission, did you receive any reimbursement on those advance payments? And one final question. No, Chair interrupts to say that's it. I've given you an extra minute or two. We have to respect speaking time. Thank you, Michelle. Now, Jutta Paulus.
Okay.
Yes,
you have the floor.
Thank you very much. And thank you indeed, Mr. Elving and dear Joël, for the presentation. Very, very interesting. And I'm happy because Véronique Trier-Lenoir had already my first question on the liability. It is asked already, so is it not time to change and to put the liability again on the regular terms where it belongs, because we are not in a state of emergency anymore, to put it on the companies again? That was my first question. My second question is recommendations I would like to hear from you regarding transparency on the whole procedure. And are you on our side if we ask for more transparency regarding the contracts in general? And then another question I have, which was not asked so far, is about you assessed the whole supply chain. And do you know, and the question goes, of course, also to the Commission, who is here, which I'm very happy about, did the Commission ever consider public ownership of manufacturing sites? I'm speaking more about the future because it's also about recommendations, what we should do here. And then, nevertheless, I come also back to the liability and indemnification clauses, as well as the clauses for delivery and manufacturing. Do you have comments regarding the clauses on IP rights? Do you know if the participation in patent pool was ever discussed? And again, the question goes to the Commission also on that. Thank you very much.
Dann darf ich das Wort an
Virginie Joron now has the floor. Thank you, Madam Chair. I too would like to commend you on a very rich report, a lot of data. You say that vaccine procurement is covered by special procedures, new powers given to the Commission, not enshrined in the treaties. The Commission negotiated on behalf of Member States. Quite surprising, you note that the Commission did not fully analyse production and supply chain problems. It only did so after most contracts had been signed. The pharmaceutical industry put pressure on the joint negotiating team to go down the same path of the EU as the US to relieve the companies of any liability for COVID-19 vaccine side effects. What about preliminary negotiations? You say that your investigations there have not produced results. Now, let me touch on CureVac. It received 5.5 million. The order did not go ahead, it was cancelled. Have you put in place a procedure to recover the funds paid out? Second question to the Commission and the Court. In your report on page 9 and 10, you talk about 160 million contracts, 4.6 million doses, and a number for Pfizer. Did you look at the Commission study or the lab's study or analysis that would justify placing an order for such a large number of doses? Why did the Commission place such a large order? In May 2020, France threw away some 3.6 million. 30 million is to be thrown away now. So in total, there's 1.1 billion COVID vaccine doses that will be destroyed. So we have excess orders being placed. Is this, if you like, tantamount to embezzlement of public funds? Thank you.
So, nun, ich glaube, von ID kommt.
I don't believe we have anyone from the ID group, from the budgetary control side, so I'll give the floor to Joël Elvinger and then Mr. Philippe.
Okay. Bon, merci pour toutes vos...
Thank you for your questions. Since most of the questions were in French, I'll try to offer my replies in French. Firstly, on the experience of the negotiating teams and the steering committee, the profile of the committee members varied enormously on the European side. If you look at paragraph 26, what we state is that unlike in the UK and US, we in Europe didn't have any experts in logistics and supply chains. That was the real difference. Before beginning supply procedures, the Commission had not really considered this in putting together the negotiating teams, but we did have very varied profiles. It's just we didn't have any experts in logistics and supply chains, and that indeed was different in the US and UK. On clauses dealing with priority access, those clauses were added later. The Commission did realise that this was a problem when it came to supplies from AstraZeneca. A mistake had been made, and so for the new contract signed as of 2021, that type of clause was added. On liability, corporate liability, and the shared liability between companies and member states, that was a choice made by the Commission when negotiating the initial round of contracts. We wanted to ensure swift access to vaccines. That was a top priority, and liability was a key issue. It was part of negotiations. Member states agreed to foot the bill for any compensation if legal action were taken. The Commission never went beyond the lines of the Directive on Product Liability. There were contracts signed that stated that the liability clauses could be reviewed in future. We conducted a survey amongst member states, or the members of the steering committee, to identify their thinking here. They felt that these clauses could be reviewed once the market authorization had been issued. Moving on to the request for access to documents. We asked for all documents dealing with all preliminary negotiations. We asked for briefings, memos, text messages, the lot. These various types of documents were key for the price set and the size of the orders placed. Unfortunately, we weren't given full access, and that does tie our hands a little bit. Under the treaty, we should have access to all these documents. The European Ombudsman has also issued a recommendation calling for greater transparency. We are where we are. Moving on. Questions on pricing. Well, price negotiations probably covered in documents to which we didn't have access. The text messages, for example. Unfortunately, in addition to the documents on preliminary negotiations for the largest contract, apart from that exception, we did have access to all the other documents. But of course, we're bound by the rules on confidentiality of contracts. So we did have access to all contracts other than the ones that you mentioned. On advance payments made to manufacturers whose vaccines did not end up on the market, that was a choice made by the Commission. It knew that this was a huge risk, making such down payments. There was a real risk that some of these vaccines would not make it to the marketplace. And that choice was made to ensure swift access to vaccines. Looking at the documents we received and based on discussions during the audit, it was clear that the Commission was well aware that not all manufacturers would manage to market a vaccine, and that was a risk worth taking.
So, then moving on to the question from Tilly Metz about transparency.
Already 6 minutes for you alone.
Okay, for Tilly Metz, we didn't look at the IP rights, and as regards the transparency, I think I gave the reply already. So, sorry.
Ja, Philipp, es waren so viele Fragen an Sie.
Well, so many questions for you. I'm happy to give you a little extra time if you need it.
Much. I think some of the points were already addressed by Madam Elvinger, so I will not return to that because they were factually correctly addressed, I must say. So, but I mean, just a general remark. All of these contracts were negotiated with all member states. All member states had full access to any kind of relevant information about the negotiations at any moment throughout the process. That was obviously done with a joint negotiation team. Clearly, you cannot sit there with 27 plus somebody from the Commission and negotiate one single contract. It was all done basically in parallel with multiple companies, but member states always had full access to all information, including on pricing, including on volumes, and they always had the possibility to opt out of these contracts. So that possibility was there until the contract was signed. Just as a general remark, that brings me to the pricing question, why the price rise from 15 to 19 euros. As you stated, you have to see each contract is very different. The second contract was negotiated at a different time than the first round, which was done in a, let's say, massive global competition. And here again, beginning of 2021, the competition was perhaps even higher. What was achieved also under this contract is a bigger deal of flexibility, and nowadays member states are benefiting of it by having very flexible delivery schedules. We have first-line access to adapted vaccines. They're now delivered. You all know about the BA4, BA5, BA1 that came in. So I think we should see the benefits and the positive side of this. That comes sometimes with a price, and negotiations are not just copy-paste from one contract to the other. The upfront payments, we have to see that the contracts provide for 5 years and it's foreseen to carry out audits. We have received accounting from companies for upfront payments. However, we have to see that obviously the upfront payments were part of the de-risking of the investments by the companies at a time when we all needed vaccines and we did not know which vaccine producer would be successfully coming to the end. I mean, it is not just about having something in the laboratory. You need to get it through the clinical trials in humans before you bring it to the market. And that is then obviously, and I mean, just a short side remark on the side effects. All of these data submitted to the EMA, to the European Medicines Agency, are obviously assessed by professionals and people that do their best to assess in how far these vaccines are effective and safe. And that was done by the EMA. So we had then access to multiple formats, multiple technologies of vaccines, luckily, as we have seen it throughout the pandemic. On the liability product directive, I think that was already mentioned. You mentioned specifically Sanofi and CureVac. I mean, from CureVac, obviously we received as well an accounting and obviously also reimbursement in a different way of what was not spent yet on their production. We have to see on the patent pool. That is something. I would need to inquire. I remember there was a discussion, but I mean there's always time for that discussions. During the height of pandemic, when everybody's running for vaccines, access to vaccines, it might not be the optimal time point, but we will follow up in writing on this point. Now. As you mentioned, Ms. Hohlmeier, that obviously the point on the access to the contracts, and I don't want to repeat what was mentioned several times by Ms. Gallina, by other representatives of the Commission, but on the point on the preliminary negotiations and the point that was mentioned by Ms. Elvinger also on the request of the European Ombudsman. I don't know if I should read out now a formal line to take. Do we have time for that? I can do it? Okay. So the Commission has duly assessed the recommendation issued by the European Ombudsman in relation to its response, a request for public access to documents submitted under Regulation 1049 of 2001. In its reply of 27th of June, of this year to this recommendation, the Commission confirmed that the search for relevant text messages in possession of the institution corresponding to the scope of the request and responding to the records management criteria has not yielded any results. The Commission confirmed that this specific request for access to documents was handled in accordance with the rules under Regulation 1049/2001, and more generally, that search and handling of documents for the purpose of public requests for access under the regulation is justified and follows the established practice. The Commission also mentioned its intention to issue further guidance to its staff on modern communication tools such as text messages and instant messages, notably to ensure a greater certainty in the application of Regulation 1049 and to reach out to other institutions in the EU and propose to draw up together such guidance for their staff. The Commission has initiated this process and has reached out to other institutions to get their views on the opportunity of developing a common approach. Thank you.
So, nun folgen wir weiter und
So let's continue, and I'll hand over to my colleague.
Let me go immediately to Mr. Terhes for ECR Coffee, please.
Thank you so much. And thank you, the Court of Auditors, for the report. I read the report carefully and I found many disturbing things, I would say, that should be addressed. And I quote, 71 billion euros worth of contracts on behalf of the member states were signed between August 2020 and November 21 to purchase up to 4.6 billion COVID vaccine doses. The average cost per dose is approximately 15 euros, the Court of Auditor stated in the report. In other words, the Commission purchased about 10 doses of vaccine for every human being living in the European Union at the time when those contracts were signed. There was a huge scandal in the Parliament and in the European media about those contracts because nobody saw them. After that scandal, the contracts were released in an editable or redacted version, and this is the version as they were released to us and to the world. So I'm asking the first question to both the Court of Auditors and the Commission. And my first question goes to the Commission. And I hope the guy from the Commission is clearly listening to what I'm saying or is taking notes. When is the Commission going to fully publish all the contracts that it signed with these vaccination producers? The second question goes to the Court of Auditors. Have you seen the full version of all of these contracts? Or you had contracts or parts of them that were not released to you? The second issue that I want to address is the conflict of interest of Ursula von der Leyen and Pfizer. It is known for a fact that Heiko Hector von der Leyen, the husband of Ursula von der Leyen, the president of the European Commission, works for a medical company that has a very close business relationship with Pfizer. The audit report states, when started the negotiation in April 2020, that the European Commission, and I quote, did not have a mandate from the member state nor a final objective or strategy. It is established that these initial contacts were established without consulting or coordinating with the member states, end quote. In April 2021, it was discovered that Ursula von der Leyen negotiated directly and non-transparently with Albert Bourla, the CEO of Pfizer, which led to a new purchase of 1.6 billion new doses of vaccines. Question: considering the personal gain of Ursula von der Leyen's family, as well as the lack of transparency on how she handled these negotiations directly with Pfizer, the question that I address to both the Commission and the Court of Auditors is the following. Is this a conflict of interest or corruption or not? And if it's not, then what is? Third issue. Safe and effective vaccine and refunds. Last one. The audit report states that the whole anti-vaccine strategy started from the presumption of using, and I quote, safe and effective vaccines. We see now that these injections are not safe for many people who suffer adverse effects, nor effective, since they do not stop the transmission of the virus, as it was just stated a few days ago in this commission, and they do not provide immunity from getting infected. So the question that I address to you is the following. What can be done to get a refund? In other words, to get the money back from these pharma companies who clearly lied and misled you and us to purchase products that are not doing what they were marketed for. Thank you.
Mr. Kolakusic. Sorry. The first time that I have to announce that pronunciation.
Poštovani kolege, poštovani građani.
Thank you very much, colleagues. Citizens. Well, citizens across the whole world over the last few days have been seeing a social media post by the director of Pfizer. Well, what is the current situation with the vaccine? Can you prevent transmission using the virus? And has there been a test of the new vaccine as to whether the vaccine can also prevent transmission? And the answer was, we have not tested for it. We don't know the answer. Citizens on the social networks were then heard what the NHS had to say. After the third, fourth, and fifth doses, they tried to compare death rates among the vaccinated and unvaccinated. The scientists said there was absolutely no difference between the death rates. That's to say, whether they were vaccinated or not. They seemed to have similar death rates. No difference was identified. So then that places question marks on the future procurement of more vaccines. I think we should close these contracts early, terminate them and get that money back, billions of euros. I think actually criminal proceedings should be moved against Pfizer. They have been promoting a fake medicine, and the European budget has been damaged to the tune of billions of euros. Mrs. von der Leyen has now pledged that she will pay on our behalf all of the sums that are still outstanding. When will you cancel these contracts and enter criminal proceedings against them?
I will speak Italian. Grazie per la...
Thank you very much for your presentation today. I'd like to thank the member of the Court of Auditors. I'd like some clarifications on 2 points. On paragraph 52 of your report, you described that on the 31st of December 2021, 5 vaccines had been authorized for use in the European Union. 4 manufacturers had provided 952 million doses, most of those based on mRNA technology. However, the percentage of vaccine doses actually administered was actually higher, because a lot of the doses donated to third countries were actually manufactured by AstraZeneca, and these are viral vector vaccines. So I was wondering, what are your choice criteria? Why have you been donating to third countries the viral vector vaccines rather than the mRNA vaccines? Second question, paragraph 76, where you note that member states had taken on some of the manufacturers' risks in terms of payment of legal expenses linked to the administration of the vaccines. I'll remind you that the Commission the member states who responded to the Court of Auditors' request requested a return to the normal regime once normal relations had been restored. So I was wondering how this affects the mRNA vaccines. If there is no renegotiation on the legal side, what will your reaction be?
Very much. Meneer Shaheen.
Thank you very much. The report notes that initial consideration of price, volume and third-party liability were prioritized over manufacturing capacity, and this changed over time. The EU insisted on compliance with the liability directive, albeit with considerable compensation by the member states. The UK and US choose to establish a compensation fund instead. Are there benefits of the EU approach compared to the UK and the US? My second question is on the speed of the vaccination strategy. Regarding the speed of the vaccination strategy, your report outlined that the vaccines task force of the UK and US were established fully by April and May, while it took the EU until June to present the strategy. In your opinion, while the task forces of the UK and US were large and included supply chain experts, the task force of the EU was small and did not initially include such experts. We missed speed. In your opinion, is this due to the lack of mandate from the member states of the to the Commission? Should we establish an emergency framework to allow HERA to immediately procure when a pandemic is announced, rather than to wait for a mandate from all 27 member states? Thank you very much, Chair.
Thank you very much. I now give the floor to Mrs. Elvinger for your answers, and then we go to Mr. Philippe.
Thank you very much. As regards the first questions of regarding the 4.6 billion doses in the contracts, that's actually a maximum. That's not an obligation for the Commission or for the member states to purchase all those doses. There were actually 2.5 billion doses that have been purchased, but the contracts provided for a maximum that should be able to be delivered by the pharma concerns, by the companies. As regards the access to the contracts, I have to say that we had access to all contracts in full, complete access to all contracts. Now, I'm not in a position to comment whether the contracts should be opened. I can just say that the UK and US also didn't open the contracts to public, so their contracts with the pharma companies are not public either. So. Then, as regards the study, we have, as I said in my speech, there is a study from Imperial College London, which had been published in The Lancet, which says that the vaccines have prevented almost 20 million COVID-19 deaths worldwide. Now, I'm not in a position to control and to comment this study either. And then, as regards the question regarding the benefits of the EU approach as regards the liability as compared to US and UK, I think this is a good thing for the Commission to evaluate in a later stage whether which approach was more successful, and then whether we should give mandate to HERA or to 27 member states. I think that's as well a political decision, and I think the Commission here did a first try with the advanced purchase agreements, and it did work very well. And afterwards, I think we now analyze these agreements and we analyze the procedures, and it's up to politics now to follow up with decisions. Thank you very much.
Thank you very much. Mr. Philip, before I give you the floor, there's one question that I still really want to add, because it's been questioned and it hasn't been yet answered. And do indicate if it's not up to you to give that answer, but then give it to the political representatives, because I do know you're a civil servant, and sometimes you gave a statement on the SMS of Mrs. Ursula von der Leyen. We know about that. The ombudswoman said there was maladministration, and we still don't have a good answer to that, I have to say. But with regard to the ECHA report today, I still haven't had a sufficient answer in my thinking on the lack that, the fact that ECHA did not have access to the preliminary negotiation documents. There are documents that prepare negotiations, and that you haven't answered yet, and that is key in the ECHA's report, and also for us it is a key element, because it is an integral part of what should be a good and a decent procedure. And we didn't get any answer to that. And if there is a connection, if that means if there are no preliminary negotiation documents, then they were within the SMS of Ursula von der Leyen and Mr. Bourla, sorry. And so there is a connection there. And I just say that again, if you cannot answer the question as a civil servant, I completely accept that. We will go to of course, the Commission with that, but then you can take that message back home so that that can be prepared, because it is key, and it's one of the key elements of the ECHA report. That always also has been very positive on all the things the European Commission did, let that be clear. But that is key, also for us as COVID committee in the lessons learned. Please, you have the floor.
Thank you very much. So we take note of that and take that question home. We could reply in writing to that in line with all the rules. There were a couple of points that came up. Some of the points were already addressed before, so I tried to keep it relatively short. On the volumes. 4.6 billion doses, 71 billion euros spent, average cost. I mean, each contract was different. Each contract has different prices. There were different approaches, and at the time when these contracts were concluded, we did not know what is going to work, what's going to make it to the end. I mean, we see that we are still now in the process that we have one product coming, hopefully pretty soon, to get a marketing authorization as booster. No? So that's the finalization then, basically, of this whole process, which is now going on since 2 years. And therefore, it was absolutely prudent to go for this portfolio approach. we also would not know how the pandemic would develop. It was clear that this virus has a huge dynamic and would further develop. So, therefore, better to be safe and better to be on the safe side and have more vaccines than you might need just for one round or a double vaccination, and then you come to an end. Now, when it comes to the effectiveness of the vaccines, these vaccines are highly effective. We see it. We have reduced numbers of hospitalization. We have reduced numbers. We have reduced numbers of severe disease, and that is what these vaccines deliver. One need to choose in a pandemic what needs to be the specificities of a countermeasure, of a response, and these vaccines did fairly well. Now, if you want to have a vaccine that prevents transmission, perhaps by luck we could have got it, but it is not there yet. There is work going on in this direction, but it's a completely different design of these vaccines. Just let me show you on this one. On the death rates and the figures from the NHS, they're not known to me. I would think that this is highly unlikely from a scientific standpoint and from everything we know about how these vaccines work, that you have the same death rate between vaccinated and unvaccinated. Never heard of this, but okay, I'm not reading everything, and we might have different sources of information gathering. Now on the export, all types of vaccines were exported. So all technologies were exported. And it's not just that it is exported what is left over. No, it is exported what helps the countries that also request it. The different vaccines had different features. The Janssen vaccine is only one shot. That is very good in certain countries. You have to see that it's not going into the same areas as with the same infrastructure and healthcare systems as we have it in the European Union. So here we are also depending on the wishes and the need of the countries asking for this. On the speed of the whole process, coming up with a vaccination strategy, with a vaccine strategy, I responded to that earlier already. Now with HERA we have a system in place where we can structure these processes and make sure that we have prior agreements and also lines of and also procedures in place that would allow us to procure quickly, ideally already based on pre-reservation contracts, vaccines that would help us to get out of or to address the next epidemic and pandemic. On the transparency point, let me just say that we have been done the largest possible. We have been done everything to provide the largest possible transparency in the negotiations with the companies for the purchase of the vaccines. We have obviously redacted the contracts, but this is done in full compliance with all the applicable rules related to public access to documents. Thank you very much.
Thank you. No, we're finished. I'm so sorry, we're finished. You took 3.5 minutes instead of 2. You need to be concise in the way you address.
I am, but with all due respect, the representative of the Commission made some comments.
Again, Mr. Teres, not every hearing, please.
Well, it's an important hearing, with all due respect. They are here to answer questions, and they haven't answered concrete questions that we ask, with all due respect.
I did mention the fact that he might not answer all the questions as a civil servant. We will have commissioners, and we will come back to that. Okay.
And Ursula von der Leyen should have been here then to answer the questions, because people of the European Union want these answers to be...
Stop it. No. Look, Mr. Teres, I'm going to do something about this way of functioning here in the committee. This is not going to work anymore, okay? So you don't just intervene like that. You pay respect and you ask for the floor, and you not just take the floor. Okay, Mr. Philippe, thank you for answering the questions. And as you said, you will take back the unanswered questions, since you know that for the COVID committee, but I can speak for the Budgetary Control Committee as well, these are still important questions to be answered. And I really want to stress that the COVID committee is not a committee about blaming and shaming. it was an extremely out of the ordinary situation in the pandemic. And as you can read in the ECHA report, a lot of excellent things has happened. Think about the ramping up of the production. We didn't have the expertise, but then we gathered the expertise and we did what needed to be done. And the outcome is important, but also the process is important, not for blaming and shaming, but to take the lessons learned. Because otherwise we will not be prepared for the next pandemic, and that's why we installed this committee, and that's why we need these answers. But Mrs. Elvinger, again, thank you so much. As I said in my introduction, but I want to repeat it, this is a very good report, and it really proves how important ECHA is for the European institutions. We need auditing to improve ourselves, and the European Parliament needs very good and straightforward reports. And we will take that on board in our final report in the COVID committee. And if necessary, we'll reach out again if we still have questions for you. Colleague, please.
Thank you very much. I appreciate it very much to chair together with Kathleen as chair of COVI. As Cont Committee, we have, let's say, the new tradition in this legislature, really to cooperate largely with other committees, and I think this has a very good synergetic effect. I wanted to ask you, Mr. Philip, perhaps I would be very thankful if it would be feasible that some questions you were not able to answer today, not only on the preliminary, but I think there were questions about what kind of vaccines were given to COVAX, and that would be very nice, perhaps to receive some information, because you already did several times, but perhaps to repeat it and to avoid any fake news that sometimes are running around. And then secondly, even if we have the freedom of expression, to be very clear, we are here factually based. And ECHA had the possibility to check the contracts. So this is already a step forward, because before this was not the case. And I think that ECHA would have informed us if there would have been, from their point of view, issues that we were not able to see. So this is already a step forward in the right direction. Secondly, I would clearly ask colleagues, as Kathleen said, to respect first the procedures, and then secondly, not to speak about any kind of crimes if there are no evidences for it. So this is, or criminal acts, if there are no evidences about it. This is not the way how we are acting here. So I really apologize for this, because if you would have any evidence, please show it to us, please give it to us, but I don't see, there was never ever given any kind of evidences for this kind of accusings. So if you don't have any evidences, don't repeat it. If you have evidences, then please at once give it to the authorities that are responsible for these questions. So to be very clear, because we as Cont Committee, we are working on factual basis and not on the basis of political attacks in a quite rude manner. For us, it's important for our credibility to have answers on the preliminary contracts. This is what we shared together with the COVI and with the colleague Michel Rivasi, not because we believe that there is something irregular, but to have the information, and even if this information may, perhaps you can give it to the commissioners, even if this information was unusual for the time, I think in every member state we had so many unusual kind of information, contracts, whatever, or contracting or talks, because this time was a pandemic time and it was a total unprecedented event or a situation that all governments were facing. But as Kathleen was saying, we want to learn out of it, to make it better and to be quicker the next time and to be better prepared. And for this, I would have one question that I ask you for both committees and for the whole Parliament to be answered. How will you include the Parliament in your future structures of pandemic prevention? Because I heard a lot about member states and about Commission. I heard nothing about Parliament's involvement. So I think for all colleagues, it would be important to know how will you in the future, if something happens like this, involve the Parliament. So perhaps you could add this to the written question. So I thank you now for all your replies and for your readiness to be with us and for all the work that the Commission has done during the pandemic, because I think for the Commission it was really a challenge suddenly to be responsive. 27 member states asked you to do these procurement procedures, so it was not up to the Commission to decide it, but it were 27 member states asking you to do this. This was one important thing that has to be mentioned at the end. So I wish you the best, and I hope that you can give us answers for better prevention or a better preparedness and resilience for the future in the next months. Thank you very much, Mr. Philip, and to the whole team of Commission. Thank you very much, Joël Elvinger, to ECHA, to this excellent report, and to all colleagues contributing. Thank you very much.